President Rodrigo Duterte says the Philippines may have to revert to stricter quarantine measures in general to prevent the spread of the Delta variant. This as the death toll due to the more contagious COVID mutation climbs to 3. The latest casualty discovered was a 58-year-old female from Pandacan, Manila, who died on June 28. The other 2 fatalities were a 78-year-old female from Baybay, Antique, who died on May 30th, and a 63-year-old male MV Athens crew member who died May 19th.
We may need to reimpose stricter restrictions to avoid mass gathering and prevent super spreader events. I urge the DILG and the PNP to implement existing protocols with greater urgency and necessity. It is only by imposing these restrictions that we can fight the threat of Delta variant.
The Philippines is also boosting border security as the COVID-19 Delta variant ravages neighboring countries in Southeast Asia. Police Chief Guillermo Eleazar says they're ramping up patrols in the Sulu archipelago to prevent the illegal entry of people. They're particularly keeping tabs on the borders in Basilan, Sulu, and Tawi-Tawi, which may serve as entry points for those coming from Indonesia and Malaysia. Authorities are also coordinating with local government units and maritime agency in boosting security in the area.
While government tries to prevent the entry of more Delta variant cases, a group of researchers fears local transmission of it is already happening in the country. Professor Guido David of the Octa Research Group says this can go on untracked since the results of genome sequencing are not released on time. Genome sequencing is the procedure needed to determine which COVID-19 variant is present in a patient.
Bumalik po tayo, no? So that is our existing protocol right now. If we detect a specific variant of concern among the population o yung mga individuals na nag-positive po at natag na as recovered, binabalikan po natin. So binalikan po natin itong mga local cases natin at ito po ay atin pong pinarantin muna po sila lahat hanggang lumabas ang kanilang resulta dahil nag-retest tayo sa kanila. And among the initial results that we have received, meron po sa kanilang nag-positive pa rin, chinecheck natin ang CT values, and they will remain to be isolated until they turn negative after 14 days.
So far, the Philippines is only able to process 750 samples every week, which is less than 1% of the total number of COVID cases recorded in the week. Health officials admit this needs to be improved.
Na-detect po yung variant na Delta dito nung Biyernes, tayo po ay nakipagpulong na ng mga emergency conferences with our local government officials, local health officials para po makausap natin sila at maiparating sa kanila kung anong dapat restrictions sa meron. We would like to anticipate, we would like to be one step ahead kung ano-ano man po ang mangyayari. Kaya po araw-araw, titignan natin ang ating mga datos, titignan po natin kung kailangan na natin mag-escalate agad. Hindi po tayo mag-wait and see.
Tracing efforts are intensified for the close contacts of the Delta variant cases in the country. As Michael Deliso tells us, at least one of them already tested positive for COVID-19.
The Philippine Department of Health is retracing the close contacts of 35 Delta variant carriers in the country after some of them still tested positive for COVID-19.
Among the initial results that we have received, meron po sa kanilang nag-positive pa rin. They will remain to be isolated until they turn negative after 14 days.
The DOH did not provide the exact number of close contacts who tested positive, but in Manila, one of the 36 close contacts of 2 Delta carriers tested positive.
Bago sinabi sa amin ng DOH, ay 3 weeks old na. So, my take is, most likely they're going to turn negative, which lumabas nga negative yung mga initial na contact trace at merong isang nag-positive. But rest assured that due diligence are being done by the city health department.
The Manila government sees no need to submit the sample of the infected close contact for genome sequencing, saying it is most likely a regular COVID-19 case. The DOH earlier reported 2 Delta cases in Manila. One case was tagged as dead after being rushed to the emergency room of a hospital on June 28. The other case is an outpatient with an onset date of June 23 who was tagged as recovered already. While Mayor Moreno admits the Delta variant could be spreading in the city already, he will not implement stricter restrictions yet. But he is pushing for stricter border control, quarantine, and ramped-up vaccination.
We must learn how to live with COVID-19. At the same time, we must learn how to go back to work safely. So, COVID-19 will stay. We cannot go and, continue to live in fear. That will not bring us anywhere.
In Taguig, the local government clarified their lone Delta case, which is a returning overseas Filipino worker, has no close contact. The OFW who tested positive in May was not released from quarantine until he recovered. He did not set foot in Taguig when he was still infected with the virus. The DOH said this is not considered a local case.
Ay isang returning overseas Filipino and was quarantined in Silver Oaks at kasama po siya dun sa MV Athens case, pero hindi po siya kasama sa mga local cases natin.
In Antique, where there is one death and one recovered from the Delta variant, the local government is still conducting contact tracing up to the third-generation close contact and continues to monitor individuals already tested negative. Antique Governor Rodora Cadjao says COVID-19 cases are now manageable and strategies to control the spread of the virus are still in place. In Cagayan de Oro City, Mayor Oscar Moreno suspects the city's COVID-19 surge from early May to June was due to the Delta variant. The 5 Delta patients have recovered from the illness, but they were still gathered to be isolated while their close contacts were put in a separate facility. Michael Delizo, ABS-CBN News.